today's video, we are going to be talking about different tips of pregnancy, the different things you should know when you're pregnant, and we are going to be talking about 10 beautiful different tips. Please stick around because you might find this information useful. Welcome back to my channel. If you're new here, welcome. And if you're an OG, an old subscriber, a returning subscriber, thank you for coming back. I really appreciate. Okay, for those of you that are new here, my name is Daisy Peter. This channel is about pregnancy, motherhood, and laughter. So in today's video, we are going to be talking about different tips of pregnancy, the different things you should know when you're pregnant, and we are going to be talking about 10 beautiful different tips. Please stick around because you might find this information useful. Okay, one of the tips we are going to be talking about is do scan early. Once you notice that you're pregnant, the first thing you should do is to go to the hospital where you register to run a scan. Some people do not like going to the hospital. They like going to the scan centers to run their scan, but it is very necessary that you run your scan because the scan will help you to tell the condition of the baby, to help you tell if the baby is well positioned. It will help you to detect any error if the child is rightly placed in the womb or not. And then another advantage of doing scan early is that the real date of the EDD will be shown. That's if the scan you do at the 8 weeks of your pregnancy tells you the real date of your EDD. And what do I mean by EDD? Your EDD is the expected date of delivery, the date you're supposed to deliver. The first scan will tell you. So subsequently, before you deliver, you will still be running tests, but that first EDD date that your scan gave you, the first 8 weeks of your running scan, will determine the correct date of your EDD. So if you're doing other scan after some months and all that, and the date is irregular, you can just quickly run back to the first date that your EDD gave you, and that date will be your delivery date. The number 2 tips is start antinata. Even if you're not a first time mother, even if you've given birth to how many children, it's always good for you to start antenatal because you never can tell. All pregnancies are not the same. That your first pregnancy, your second pregnancy gave you a particular result does not mean that your second child will be the same way. There are some people that in their first pregnancy there was no issue, then the second pregnancy they detected some errors and all that. There are also some people that in their first pregnancy they had numerous problems, but in their second pregnancy and subsequently there is no issue at all. So the second tips and very important thing that you should do is go for antenatal. Register in a good hospital and start your antenatal. Don't miss your antenatal. I know that I told you that this channel is antenatal near you, to all those lazy moms that pregnancy will deal with and they cannot move around. But nevertheless, antenatal is very important. In antenatal classes, you're taught on how to take care of your baby, the signs you will notice, and the ones you should raise alarm about. So antenatal is very, very important because each visit you go, they check your vital signs, where they check your BP, they check your sugar level, they check if you have any infection and all that. And you know that infection in pregnancy can cause miscarriage. So take your antenatal visit very serious. The number 3 tips is register in 2 hospitals. One of the hospitals you should register maybe is the one that is close to you, and then like I know some people like to register in government hospital because they have experienced doctors, experienced practitioner and all that. But most of the time this hospital is not close to you, it's very far. So I would still advise that you go to go to any other private hospital that will be close to you and register. The reason is that labor can start anytime. Labor does not tell you when it will start. I know that there is EDD, but the moment it will start you don't know, and it might be case of emergency. So that if the hospital that is far away from you is not nearby, the hospital that the other one that is far away from you, you can go to the one close to you, and that one they already have your details. In case of emergency, they don't have to run your test to know your blood group, to know your blood type, to know the things that they should do, because when you go for antenatal they normally ask of history of your previous childbirth, or if you've not given birth before. There are some tests they run, so they know what they should do for you when you want to give birth. So registering in this hospital will give them the database or information about you in case of emergency or something. They don't have to be running tests to know what to administer to you. That being said, let's go to point number 4. Do not fail to take your routine drugs. Yes, there are some medication that a pregnant mother takes, and these are called the routine drugs. Their name is folic acid, bico, and fesolate. These routine drugs help for the growth of the child in your womb. So ensure that you take your routine drugs judiciously. Be faithful to it. Don't take today and skip tomorrow. If you don't take your routine drugs, if you don't take it serious, it might harm the growth of your child. If you're a mother that have been having miscarriages, I will advise you, do not engage yourself in any strenuous job. Don't engage in any exercise, anything that will stress you. Do not engage in it, because any little force can push your baby down, can terminate the pregnancy. So you might want to not move around anyhow, any place that is not important, any occasion or function that is not important. You just stay one place for the safety of your child. Do not move around. And you might also be wondering that, okay, this is my first time, I've not had pregnancy before, so how will I know I will have miscarriage and all that? It is advised that when you're pregnant, especially for the first 3 months, do not engage in strenuous activity. Don't carry heavy load. Once you notice that you're pregnant, you have to be careful about the kind of activities you do, the kind of exercise you do. Point number 6 is maintain a good personal hygiene. As a pregnant mother, you have to maintain a good personal hygiene. Make sure your toilet is regularly washed, because when a woman is pregnant, her whole system is very open. It accepts any form of disease so quickly. So you have to be very careful and take your personal hygiene very serious. This video is already becoming too long. I think we'll have to wrap it up very soon. Tip number 6, eat your normal food. Yes, a lot of people are always scared of, they say I should not eat this, it will harm my baby, they say I should not eat. No, that you're pregnant does not mean it's death sentence. You can actually eat your normal food as a pregnant woman, but one of the things you're supposed to avoid as a pregnant woman is alcohol. You take any other normal food, take fruit, take the food that your body system can accumulate. I know that as a pregnant woman, there are some food that you take that you become allergic to. You see yourself not eating the things you like to eat, but for the safety and the good health of your child, you have to eat healthily. The ninth point is always redo your scan. Like the hospital I give birth to my children, the scan they give there is always 3 times. The first scan is the first day to go for your antinata, normally when you notice that you're pregnant. Then in the second trimester, they run another test. Then in your last trimester, they run another test. This test is done to ascertain if your baby is growing, because in every scan you notice that the weight of your child has increased. This scan is used to ascertain if the baby's heartbeat is okay and all that. So you should always try to go for your scan, so that you don't give birth to a stillbirth, like a child that is already dead. So your scan is very important. Always redo your scan. Then finally, on our list, which is the 10th one, do not argue with your doctor. Do not argue with your doctor when it's time for your delivery. A lot of people say, especially people that are from the village area, or I don't know how to call it, they say I must deliver like the Hebrew woman. Remember, the Hebrew woman is the woman that entered the labor room, the delivery room, and came out alive with the child, and she alive, child is alive. That is the Hebrew woman. So it does not mean the method you use to bring out the child does not matter, because even the CS, some people enter there and they do not come out. So when your doctor tells you that this child is delivery, that you're going to push it, do not argue. If your doctor also tells you that this child is through CS, do not argue. Adhere to the instruction of your medical practitioner, because they will not lead you astray. I've seen cases where most people argue that they want to give birth to the delivery woman, they argue and all that. At the end of the day, they will go for CS, and if care is not taken, the child in the womb will already be dead, because the child has gone through pressure. So that is all for today, and I hope you found this useful and important. Please, if you've not subscribed to this channel, hit the like bell, subscribe, please, I'm begging, subscribe, and then turn on your notification bell so that you'll be notified when I bring more videos. Thank you for watching. Bye.